Hi, beautiful people. How are ya? I hope you're having a great day. The etiology or cause of a disease remains elusive in fibromyalgia, but due to potential pathophysiological processes associated with fibro, researchers search for effective treatment options. The pathophysiology of a disease is the study of a disease and the dysfunction of that disease. Think pathology and biology together. Fibromyalgia is a complex chronic pain disorder that significantly impacts the quality of life of affected individuals. There are pharmacological and non-pharmacological interventions for managing fibromyalgia. For years, it's been known that fibromyalgia patients need a multidisciplinary approach to treatment. There isn't a one size fits all. We need options to alleviate our symptoms and improve our quality of life. So today, we're going to discuss the spectrum of current treatment approaches for fibromyalgia. Here we go. Pharmacological treatments for fibromyalgia include analgesics, antidepressants, anticonvulsants, muscle relaxants, and opioids. Analgesics can provide short-term relief for fibromyalgia, but are generally not recommended for long-term use due to potential side effects. Antidepressants include selective serotonin reuptake inhibitors or SSRIs, but are not approved for fibromyalgia. They're approved for depression and anxiety. These include fluoxetine and sertraline. Selective serotonin norepinephrine reuptake inhibitors or SNRIs include duloxetine and milnacipran, and tricyclic antidepressants are often prescribed to regulate levels of neurotransmitters involved in pain perception, such as amitriptyline and cyclobenzaprine, also called Flexeril. Anticonvulsants, such as pregabalin and gabapentin, work by reducing nerve activity involved in pain signaling. Muscle relaxants, including cyclobenzaprine and tizanidine, reduce muscle spasms and promote relaxation. Opioids may be used in severe fibromyalgia pain, but they're not recommended for long-term use due to the risk of dependence and worsening symptoms over time. In addition to pharmacological treatments, non-pharmacological treatments include cognitive behavioral therapy or CBT, exercise, sleep hygiene, CBD, occupational therapy, hydrotherapy, transcutaneal electrical nerve stimulation or TENS, graded exercise therapy, psychological therapy, and complementary alternative therapies such as acupuncture, massage therapy, and mind-body therapies, and also dietary supplements. Mind-body interventions include mindfulness-based stress reduction that targets stress, anxiety, and depression. I talk often about exercise, that 8-letter word that sends chills up our spine. But even though we may have a fear of it, studies have shown that exercise therapies such as aerobic exercise and resistance therapy and resistance training improves our symptoms by reducing pain and fatigue and improving physical function. Low impact aerobic exercise is walking, swimming, and cycling that effectively improve our symptoms But for me, stretching exercises should be part of our everyday lives to improve muscle strength and, most importantly, flexibility. How many of you are stiff? I deal with that daily. And if I don't start my morning with stretching, I'm miserable all day. Strength training has also been found to support muscle strength, but this must be done slowly and carefully. I know there are many of you who use acupuncture. I haven't, but I can see how it could help with targeting specific points of the body. TENS units are non-invasive and have been shown to reduce inflammation, reduce pain and fatigue, and improve quality of life. Hydrotherapy is a much appreciated therapeutic experience. Warm water immersion or aquatic exercise has been shown to be effective in reducing pain and fatigue and improve physical function. Yoga involves the practice of physical posture, breathing techniques, and meditation to improve physical and mental health. Music therapy involves the use of music for therapeutic purposes, such as relaxation and pain management. Tai Chi is a Chinese martial art that involves slow and controlled movements and meditation that has been found to reduce pain and fatigue and improve physical function. I can't imagine, as a psychologist, not talking about CBT, cognitive behavioral therapy. This is a type of talk therapy that focuses on changing negative thoughts and behavior to improve mental health. Patients are taught coping skills and relaxation techniques and help them to identify and challenge negative thoughts that may contribute to symptoms. Improving quality of life is the main goal. Occupational therapy can help patients to maintain their daily activities. Massage therapy involves manipulation of soft tissues, which it seems that you either love it or you hate it. And dietary supplements like magnesium, soy, and creatine have found to have potential benefits. Sleep hygiene interventions are also important, including management of insomnia and medical conditions such as obstructive sleep apnea. I believe it's important for people with fibro to have a community of like-minded individuals who support one another. Online support groups are one type of community, but I would also like to introduce you to our new members-only group. I think the most beneficial and important aspect of this group will be in getting to know one another. When you come to this channel, you'll notice a join button under the video next to the title of the video. To help with the cost of creating this place for us to get to know one another and learn is a small monthly fee. I hope this will be a place where we will love and support one another. And I hope that you'll participate in this member group to give us an opportunity to get to know one another. Lastly, individuals with fibromyalgia must work with their healthcare provider to determine the right treatment for you. How many of you see multiple doctors for the different clinical conditions you have, from your family doctor to a rheumatologist, which is the most common, an osteopath, functional medicine doctor, a gastroenterologist, neurologist, podiatrist, physical therapist, pain management specialist, sleep specialist, and mental health specialist. Alternatively, we may also find an acupuncturist, chiropractor, massage therapist, or dietitian to help us manage our symptoms. We have individual needs and abilities, and all of those matter. We matter. You matter. Interestingly, for some, opioids are not considered helpful. But as I've said before, this is a risky treatment. However, if you're 80 years old and nothing else is working, I say go for it. But according to research, opioids are not found to be helpful or effective in fibromyalgia. NSAIDs are not found to be helpful, and corticosteroids are not found to be effective, but I've found them to be most helpful when I'm in a flare. So it depends on the person. Disease modifying anti-rheumatic drugs, also called DMARDs, are often prescribed for people with other rheumatic conditions like rheumatoid arthritis, lupus, ankylosing spondylitis, and gout. But these drugs are not considered effective at treating the symptoms of fibromyalgia. Weirdly enough, my first roomie prescribed a DMARD called hydroxychloroquine and prednisone to help me manage my pain, and it worked for me. But my second medical doctor did not want me to take those meds. Do those work for you? The problem may lie in the antibodies of people with fibromyalgia. That mouse study where antibodies were injected into mice and the mice developed fibro symptoms may finally determine what is going on in fibromyalgia, but this still may be years down the road. So please share with us all what's worked for you, what hasn't worked for you. We'd love to hear from you. I hope you learned something. I send you gentle hugs and support. Love you.